So we'll get started here. Good morning, everybody. Thank you for joining us today. So welcome back to our Global Health Conversation series. My name is Bao Tran, currently an assistant professor over at the College of Pharmacy over at USF Health, Taneja College of Pharmacy. And just want to remind everybody, this session will be recorded. We will have a Q&A session at the very end of the presentation for about 5 minutes, but feel free to drop any questions you have as we have our conversation this morning. So I'll be moderating this session with my mentor, Dr. Angela Hill, for my mentor, Dr. Angela Hill. So if you have any questions, please feel free to drop it in the chat box. We're really happy that you guys are here with us early this morning. So just to start off, our topic today is going to be on the impact of the pandemic on pharmacy practice in the US and Nigeria. I wanted to briefly introduce you to my mentor, Dr. Angela Hill. Now, Dr. Angela Hill is a pharmacist, a tenured professor, an associate dean of clinical practice, and was a past chair of the USF Taneja College of Pharmacy. She received her doctorate of pharmacy degree from Florida A&M University. She has worked and consulted for community pharmacy practices, outpatient substance abuse treatment programs, and has a couple of her own specialty areas of practice that includes geriatrics, psychiatry, neurology, alternative medicines, and substance abuse. She is also one of the pioneers for providing pharmacy services in memory disorder clinics here in the state of Florida. One of her duties as Associate Dean of Clinical Affairs includes serving as the project manager for We Care, the community outreach arm for the college, where she coordinates activities with the community to either recruit, retain, and educate minorities on research participation, provide educational workshops on disease that really plague the minority community. Now, since the pandemic, Dr. Hill has really been instrumental in providing numerous workshops on COVID, the vaccine, use of supplements, and psychological aspects of the pandemic to faith-based, civic, and social organization, to healthcare workers, and really to the community at large. So I'm really honored to have the opportunity to moderate this session today. And so, Dr. Hill, if there's anything else you want to add to that wonderful slew of credentials and experience, please feel free.
Oh, no, thank you so much, Dr. Tran, for that introduction. And you said enough.
Perfect. So just to help guide our conversations, let's start out, obviously, because I did mention that as Associate Dean of Clinical Affairs here at USF, you are the project manager for, or Associate Dean of Clinical Affairs at our college, USF Taneja College Pharmacy. You are a project manager for We Care. So can you tell us a little bit about your role as project director of We Care? That sounds like an acronym for something really important.
Well, actually, I'll tell you about We Care. We Care has actually been a fun part of the job, and as you know, the College of Pharmacy is relatively young. We were founded in 2010 with Dr. Sneed as our founding dean. And as most deans are, he was already actually very integrated in the USF health system and was a part of a P20 grant with Moffitt and the College of Public Health. And there was a Center for Centers of Excellence or Health Equity that was born out of that grant. And they primarily started out with the focus on addressing cancer disparities in the African-American community. And then, of course, as grants go, the funding ran out, and he decided to launch We Care to kind of carry on the mission of closing the gap of health disparity. So We Care actually stands for Work Group Enhancing Community Advocacy and Research Engagement. And it had a series of other names like I Care before, but they kind of landed on We Care inappropriately because we represents not just the university, but a lot of community partners, of which I'll mention a little later. So in the picture, of course, you see Dr. Sneed, and then below him is Dr. Deborah Austin, who represents one of our primary key community partners, Reach Up, and they specialize in fetal and maternal health and provide other services, and they have about 50 or more community partners. And so working with them has allowed us a broader audience for a lot of our efforts, and with the help of Mr. Hiram Green, who's under my picture, and he serves as our community relations outreach person or public relations person. And so he also has allowed us to have even deeper tentacles, in a lot of the community partners because of his 35-plus-year history with the university. So these are but a few of the partners that we've had. As I mentioned, Moffitt was one of the primary ones, but AHEC, USF Health is continually very supportive. So we work with all of the colleges. And then 50 Hoops is a national partner by which I introduced to the USF Health community, a part of my transition to USF in 2011. And so primarily the primary focus or mission, as you mentioned, is to kind of close health disparities by linking or bridging the community at large with the research community at the university, because there's a lot of barriers to participating in things like research, and USF is a research one intensive university, and so it's so important that we make sure that that happens. The other thing that is important is that the research community is in need of diverse populations, to test devices, to test medications and the like before they get on the market and cause
Right.
harm. And so we kind of positioned ourselves to really help with that education and in hopes of bridging, at least the gap of knowledge regarding research processes. So the way we've done it is by allowing there to be forums for researchers to interact with the community at large. We have a advisory board composed of community members, and we've interfaced with all levels of communities, but probably made our strongest inroads with the African American, Hispanic, Latino, and Western Indian groups. And we have focused, as I mentioned earlier, on a lot of the diseases that plague minority communities, but have expanded, as a reflection of our clinical expertise. So you see me mentioning Alzheimer's, mental
Right.
health, et cetera. And then COVID, of course, has given us a lot of opportunity, to really be able to reach these groups primarily. So that's a
Right.
little bit about We Care.
No, that's wonderful. And, as you were talking about that, it kind of it really dawned on me, as we review all these research, the one thing that we do is there's a lack of minority participation, right? So generalizability to the population is really poor sometimes, especially to the minorities. So definitely it plays a huge role in our health disparity. Um, Obviously, we're in the midst of a pandemic. So how has We Care really carried out its mission since the start of the pandemic, going, a lot of virtual social distancing and all that sort of nature? Has it really differed in how it carried out its business or its activities?
Well, one of the things that we did early on is certainly paid attention to who the disease was affecting. And, we weren't surprised that the risk factors that a lot of our minority groups bring to the table were the main reasons why we were seeing so much disparity early on. And so our Native Americans, African Americans, Latino groups were having the larger number of complications that we were seeing right off. And then we were paying attention to a lot of the surveys that came out. So early in April and May, there was a lot of data out there about, the perceptions of the community in regards to getting the disease, and particularly, as you can tell here, concerns about hospitalization and the spread of the disease. And so we were getting a lot of mixed messages through the media. It was just the way it was presented to us, to me, kind of compounded a lot of the paranoia that we saw. And as some of the surveys kind of bore out, groups like African Americans were really very concerned about not being treated, fairly, not given the attention that they would need. And as you can tell in this slide, at least 60% or more really felt that they wouldn't get the level of treatment that, maybe whites and other groups might get, which just really compounded some of the things that we have been hearing for years about, concerns as it relates to us being treated fairly. So with that, we were like thinking ahead of time, we're going to have to do a whole lot to convince, some of these groups about accepting some of the treatment opportunities and
Right.
things that are out there. And so there was this one survey that came out regarding the vaccine and whether or
Mhm.
not Americans would be willing to get it. And it was very enlightening and confirming that we had a lot of work to do. And
Mhm.
so with that, probably about May, we set up what we thought would just be a 4-part series. And we would talk about at that point the different aspects of COVID, the infection as we knew it. So Dr. Sneed kind of kicked us off. And then we had our vice dean in the department, Dr. Moore, help me out with some of the mental health aspects. And then we moved on into community resources, and Reach Up kind of led that discussion and identified opportunities for individuals to learn more, and certainly get help, because at this point, there were a lot of um, uh, as we were shutting down, people were
Mhm.
losing jobs and all
Mhm.
kinds of things. And so we really thought it would be important to talk about the resources. And then we ended up addressing some of the complications and comorbidity issues and used our own Dr. Hayward Brown, who is an OBGYN by training, but certainly very, very knowledgeable about diseases and as it relates to health disparities. And then we call it Dr. K, but Dr. Kamkarni, who's a local family practitioner, she talked a little bit about explaining more about how hypertension and some of these other problems, could increase the risk for complications from COVID. And little did we know, we probably collectively between this series had, I would say, about 150, 200 individuals that were tapped. But we started getting, to say the phone was ringing off the hook is probably a little exaggerated, but tons of emails and requests to do other talks. And so it spanned from the Lunch and Learn series to panel discussions, town halls, dialogues like this, radio interviews, and all kinds of things. Now we're at the point of supporting a lot of the local vaccination events with
Mm.
recruitment and things, but probably between the dean and myself and Dr. Austin, we have collectively done over 50 different kinds of educational workshops. And we've been able to speak to so many groups, really. And this is just a cross section of the list, but just to give you an example of the breadth and depth of how we have really made that message. And we probably have our own set of groupies who've attended one, and then they would recommend us to another group. But we're very fortunate that there was a lot of interest in
Mhm.
knowing about COVID. And so we have capitalized on that. And it's been really a phenomenal experience getting and appreciating some of the fears, that the community has,
Mhm.
definitely the concerns, and us being able to be in a position to arm them with valuable information, that definitely will help them understand and kind of, transition into dealing with, some aspects of the pandemic.
No, I think that's wonderful, and really, it's really astounding for me to hear that, because we really didn't realize there was a deficiency until you tapped into it, right? And now all these outreach and all
Mhm.
these soliciting of feedback and just help overall. I think that's wonderful.
Mhm. Mhm.
So obviously today's topic is global health initiative in Nigeria, and
Mhm.
how the pandemic has really affected practices there for pharmacy. So how did that initiative get started?
Well, actually, it was an introduction. As I mentioned, we had been doing the workshops, but also probably in 2012, if not before, we were approached by the Nigerian Pharmacists Association to help support their annual meetings by providing the CE, serving on the planning committee, and oftentimes using our faculty to help deliver content for their convention.
Mhm.
And so with that, we've now been working with them 10 or 11 years. And last year, early in the pandemic, one or two of them attended some of our work lunch and learns.
Yeah.
And there was a member who actually is a part of another company called Mega Medex that was hoping to provide education about COVID to the Pharmaceutical Society of Nigeria, which
Mm,
is based in Lagos, Nigeria. And upon that introduction, we walked away with, hey, we should look into developing an MOU and just talking a little bit more about what we could do to help them in advancing the profession in general, but then how can we help them right now during the pandemic? So we developed a monthly series of workshops. And
mm.
so every month, as painful as it is, I'm up because there's 6 hours ahead of us. I've been getting up, to try to coordinate workshops to kind of keep them abreast of different aspects of the COVID pandemic. So it has been really exciting to interface with them. But they are a group of about 400 to 600 community-based, industry practicing, and hospital-based pharmacists. And so it's been really intriguing
Mhm.
to meet and interact with them, as well as continuing our work with the Nigerian Pharmacists Association.
That shows you dedication right there, right? So for sure, no, um, that is so generous of you, obviously, in your involvement, and you chose to do that. So it really deeply reflects on your character and just how far you want to really reach, to really be touching everybody. So in regards to that, when we're talking about Nigeria, how do the pharmacy practice really differs between US and Nigeria? Can you speak upon that?
Well, part of it, in terms of education, they have the 5-year equivalent of what used to be our Bachelor of Science degree. Of course, we offer the Doctor of Pharmacy degree and have now for a number of years. So right there, right off, scope of practice is going to be limited, somewhat like what we saw in Panama, where a lot of their graduates end up going into ownership for themselves, a cross
Mhm,
section going into hospital practice, or you'll see a lot of them in industry or compounding kinds of roles
mhm.
in that regard. They aren't as advanced as us in terms of probably clinical initiatives, but you do have pockets because they have healthcare set up kind of like we have Tampa Family Health and the federally qualified health centers. They do have the equivalent over there. And of course, they have universities that are postured to also help support healthcare delivery in that regard. But those are probably the major differences, how we are educated, which then sets the stage for what they're able to do and not do in regards to patient care.
I see. So I guess not so focused on clinical, but more industry and compounding. So
Yes.
as to speak on that, the pharmacist role here in the US in regards to COVID, we actually have our hands in a lot of things, from drug development
Mhm.
for the vaccine to research trials, with the new drugs that are coming out for COVID,
Mhm.
vaccination efforts, establishing ourselves and vaccinating and providing that, reconstituting the vaccine. So can you speak a little bit about the role of pharmacists or pharmacy in Nigeria and their COVID or how they're responding to, or what is their role in the current pandemic?
Yeah, it's interesting. So, like us, the minorities have been affected the most. Heart disease is probably one of the top health conditions over there, but they still are dealing with, HIV, a lot of the antidiarrheal disorders, tuberculosis, meningitis, things of that nature. But what you do see as a common theme is lower socioeconomic groups affected the most by COVID. So they had their first documented case like around the time that we were getting piped up for the pandemic. So about February of last year.
Mm,
So there were a lot of things in common. They were experiencing drug shortages, the PPE shortages, hospital challenges, things of that nature. But their federal government provided a lot of grants right off the bat for industrial companies and some help to the uh, pharmacy community in general to kind of support things because their biggest challenge was the economic impact, and they didn't want people who were already below poverty to have further issues. So they were a lot more ambitious in terms of providing the support to the community,
mhm,
quarantining and things
mhm,
of that nature. But certainly, as we were moving and advancing a little bit more towards clinical trials and things of that nature, they were just a little slower and behind us. But they, like us, were affected by social media. And,
mhm,
so you had a lot of the unfortunate hype and myths that were developing. And so there were already suggestions that even if there was a vaccine, nobody really was going to take it or
Oh,
nobody wanted to take it. And some of that was cultural or based on past experiences from other
mm,
issues. So
mm,
one of the interesting things is, although we've had, Pfizer and Moderna since, December, January, pretty much, and we knew it was coming, they really literally just got the J&J vaccine, the first week of March. And I think they got about 39 million doses, which isn't, going to really make a major difference. But they were already organized and learning quite a bit from what other countries were doing. And as we know, we had one of the variants, that
right.
was known over in South Africa. So they were fortunate that there were actually studies on the vaccine on that particular variant, which was very important, unlike where we got the Pfizer and Moderna vaccines early on, but couldn't say that we studied those
In that
vaccines
variant,
against the
right.
variants necessarily. So I think that those were probably some of the highlights there, but economically, the blow to them has been a lot more severe, than it has been to us in that regard. And, these are just some examples of the myths that, were swimming around, not only for them, but even in the US, and certainly as we were continuing to do our work, we were recognizing the patterns of the experience in that regard. A lot of issues with thinking perhaps that this is an intentional way, obviously, to wipe out, certain ethnic groups and things of that nature. And so the pharmacist, really was trying to position themselves over there to be a resource, much like we were doing here. And so that part really made it really kind of helped. And so when we look at, how do you go kind of impact people to believe in that all is well, we really had our work kind of cut out. So being able to work with a group of pharmacists, healthcare professionals to try to dispel these myths has really been rewarding. Mhm.
Right. Yeah, for me, just being able to experience how much social media really influence the
Mhm.
population and the information or the misinformation out there is really eye-opening. Having just a Facebook account or a Twitter or anything like that, and whatever you say on there really does impact potentially millions of people. So that power alone is just very, I've just never experienced it before. And so with that comes with a lot of responsibility. Obviously, it's not just affecting the US, but obviously you as you talk here about Nigeria, and I'm sure all other parts of the world. So definitely something, more research should be done on that in regards to social media aspects with how it's affecting healthcare.
Mhm. Mhm.
So, in regards to that, and now I know you mentioned, as we talked about before, about these COVID care workshops that you were providing. Can you expand on some of the topics that were presented and what were the needs of the society?
Okay. Well, for us over here, the education piece was really big, but they wanted to know, what are pharmacists doing? Because they were, with the differences in change in scope, they really were interested. And so, like us, many of their pharmacists got involved with testing.
Mm,
And a lot of them, because we shared with them that we're doing immunization, and things of that nature, and positioning ourselves to help with that. We've modified laws and policies to address the drug shortages and different things of that nature. And they did their best with the drug shortage parts, but they were able to sell the test kits. And a lot of their pharmacists actually did get training in immunization, but they're not allowed to do it.
mm,
The doctors predominantly do it more so than even the nurses over there.
mm,
And but the nurses, are able to help in that regard. So those are, and it still remains. These are probably representative of the major things that pharmacists are doing. But some of what we did is started out talking about, okay, life after the pandemic. Meaning, what is the pharmacist going to need to be able to do, the mental health aspects. We shared with them, how telehealth, became really big over here. Certainly continued to educate them on the comorbidities and dealing with inpatient care, so antimicrobial resistance to managing the respiratory infections, because again, they've already had issues. And they seem to be also wanting to appreciate our other talents. So things like pain, were addressed as well. But we spent quite a bit of time making sure they understood the differences in the vaccines that were coming out, probably with a focus on Pfizer, Moderna, the J&J vaccine, and then the Astra vaccine.
AstraZeneca, right?
Yeah, AstraZeneca, and some mention of Novavax, because we knew that in our area we were going to be getting that vaccine. So we tried to make sure they understood the differences in how they work, the dosing, storage, the side effects we were seeing. So we did quite a bit of time, took time, and the dean did workshops. I did workshops. I identified pharmacists from other universities, certainly in some of your bigger populated areas like the DC area to Atlanta, Miami and places, Jacksonville, so they could appreciate a cross section of the experience. And so that seemed to be very, very, very well in that regard. So the mutation, so this is just a tip of the iceberg, because the questions, obviously we would spin off from the questions and trying to address that. So that part was pretty exciting. And I think that we've been able to make a meaningful difference in regards to educating them. And as I mentioned, now that they just got the J&J vaccine, a few weeks ago, most of those pharmacists are well ahead of their peers. We've probably averaged between, I would say, 80 to about 200 consistent attendees for the workshops. And so that part's been exciting.
That's great to hear. And I'm sure, as they go through these workshops, they're passing it on to their peers too, the information that's relevant. So really disseminating the information to who needs it.
Mhm.
We do have one question from one of our audience member. Are there cultural beliefs or practices that have positive or negative effect on COVID vaccination campaigns?
So yes, I think that in general, some of it is cultural, and then some of it was based on past experiences,
Mhm.
because some of the diseases, that they have as a bigger problem. And then, when you look at Ebola and Zika and some of these other diseases that weren't necessarily as much of a problem here in the States as it was for countries like that, definitely that I think that kind of fed some of the hesitancy and the paranoia, compounded by the conspiracy theories and things of that nature. I think the other pieces, though, that led to hesitancy had to really deal with the socioeconomic divide, meaning, access to care issues are real, not only for us, but also for them. And in countries where, they have more of an issue with poverty than we do,
Mhm.
there was a lot of belief that if they're giving us the vaccine and the government is paying for it, it must be something
Something's wrong.
wrong with it. And we, even address that here in the States. Why is it that they're willing to pay for this?
Right.
Must be there. But again, going back to, are they putting a tracker or a chip in us, or giving us the disease and things of that nature? So I do think it was a combination of it. I can't say that cultural beliefs were the overriding reason for hesitancy. I just think that that was very compounded by a lot of other things. Yes.
Yeah. To speak to that too, even here in the States, we do have a lot of hesitancies, even with the Johnson or
Mhm.
the Pfizer or the Moderna vaccine, not only amongst the community, but even with healthcare workers, there's hesitancy. We speak about how it was produced too fast, was there enough participants, but that's really where us as educator comes into the role of really educating the public or the community about, what was the rigor with these studies, how many participants, and kind of obviously because of the new technology of the delivery of the vaccine, because these vaccines are, well, with the Pfizer and the Moderna, they are new technology for delivering. So I definitely see the hesitancy, but at the same time, what are the risks and benefits associated with these vaccines?
Exactly. Yeah.
Um, so the COVID care clinic, for the COVID care workshops with the society, the main focus I see, these are some of the topics that you were discussing with the society. So do you feel like the focus of these topics differ from the workshops that, you or the dean or others have presented here in the US? Are they pretty much similar, or do they differ based on the needs of the society?
Well, we pretty much have stuck to the script, but one of the things with the pharmacists in Nigeria is we did allow them, or I've allowed them to give me suggestions for things that they wanted to learn more about. So,
Mhm.
naturally there was a preoccupation with the vaccine because you have so many companies making them, and then because the United States was using at least two of them before they had even gotten one. So they
Mhm.
wanted to kind of stay on top of that. Definitely because of the impact on what was happening inpatient, meaning in the hospital, and you had the hospital environment and you had limited supplies and things of that nature, they certainly wanted to stay on top of where are we with repurposing drugs and things of that nature. But no, for the most part, we kind of stuck to the same approach. Now, interestingly, when we talk of, pharmacists talking to pharmacists, one of the things we had to keep in mind is that medications that we use in the United States aren't used over there or are called by different names. So
Oh,
one or two instances in the workshops, any feedback that we got would be, oh, they always love the information, but that sometimes was an area we had to, work on making sure that we remembered that, because for us, we call it acetaminophen, Tylenol. They're still calling it, well, they use paracetamol, which,
right.
is the same, but it's tomato kind of thing.
Yes.
So a lot of times we were trying very hard not to lose them in between, those kind of discussions. And also just talking in terms of classes of drugs versus specific agents, was one little adjustment. And then I can't say with this group that language was necessarily a barrier, like when we were dealing with our Panamanian colleagues, because in this case, most of the Nigerians speak multiple languages. And if anything, though, they do love the slower cadence in the voice, and they're not super excited about engagement as us in academics, like we like to question them before and after,
Right.
but then on the flip of that, they're very, very intelligent and on top of things, and their questions would be as insightful and as provoking as what we, would see in the States. So it's been quite interesting.
I'm sure, just shifting gears, because I know how you cater to our students. We had like a lot of simulations, a lot of engaging activities throughout our lecture. So obviously, it's not really the traditional didactic course or the didactic lecture where we just, you lecture and the student listens. So definitely just shifting there for sure. Even for me, shifting that, it takes a little bit of time, and that's great. Besides the feedback, as in what topic, have you had any other feedbacks from the society in regard to these workshops, how they are presented, any adjustments, or, obviously rave reviews about your participation, any other feedbacks, or is that just mostly it?
Well, they kind of have done much like a lot of the organized social and civic groups over here, where they would have us timed to present during a standing meeting that they were having. And so with that, we'd have to be mindful of the time because they have other business, to kind of take
Right.
care of that was independent of this. And then they had sponsors for the event that wanted to, do their commercials and things of that nature. But I do think one of the things that has been probably, very encouraging is that they're looking forward to the pandemic being over in hopes of us being able to do more things beyond just the pandemic,
Hmm.
and one of the impressive things is that in probably the last four or more workshops because they would identify the dignitaries in the audience. We have had the dean and a past dean and several professors from the local university who have become groupies, and so it has it has resulted in spin-off conversations about, again, comparing, our educational training and things of that nature. So that part has been really good in terms of feedback. They felt that, certainly they see us not just in the context of COVID, but appreciating, the nuances of where we are practicing as a discipline.
Right. So there's definitely potential um, involvement, right, with our current curriculum here at USF Taneja College of Pharmacy and maybe the universities over there. So that's exciting to see, that being played out. Now, in regards to just the pandemic itself, how do you see a difference in how Nigeria responses compared to the US response to the pandemic?
Oh, yes. So as I mentioned earlier, they quarantined earlier. They provided stimulus checks much earlier, both to the business community as well as citizens themselves as much as they could. Again, they were a little slow with the vaccines, but I think a lot of that was cost. So if you look at the J&J vaccine compared to Moderna and Pfizer, we're talking about a third of the cost,
Mm,
or even less. So I do think that that was an issue of economics. But in terms of going into that whole concept of it was phased, very similar to the United States. Not that they mimicked what the United States did, but very organized. They identified who was going to get it, just very similar to us, so the older individuals, those who were interfacing with patients, or essential healthcare workers. So pretty much the same approach there. So just, differences, I think that were more of a reflection of the politics or the bureaucracy of running the country. They have, much like us, where we use the Department of Health, they have an equivalent where the state, had insight and the governor would make a decision on who got it. They have pretty much a very similar, stand up. So no, there really aren't any unique differences in terms of how we're doing that part of it. Yeah. Mhm.
Obviously, we do talk about how Moderna and Pfizer's vaccine has to be, kept at certain temperature. There's two doses, with the J&J's vaccine coming out, that's only a single dose. And it can, temperature-wise, it's not as affected compared to the other two vaccines. So I definitely see um, the ease there
Yeah.
with the J&J rather than the other two, for sure.
And the cost of those freezers is pretty substantial. It's ten to
Yeah.
twelve thousand dollars. So they did, the government made sure, that they had the refrigerators in
Yeah.
places, in the normal freezers. But yeah, the other freezers that we're using, particularly for the Pfizer vaccine, just that's not practical for where the citizens are in regards to their needs.
Yeah. And, just backtracking a little bit, and we were just talking about it, but, obviously you said that pharmacists in Nigeria can't vaccinate, but here in the States, even our students, our pharmacy students can, get certified and immunized. So we definitely have tapped into other profession to help with vaccination efforts. So I
Mhm.
do see a difference in that regards to immunization and vaccination, for
Mhm.
sure. So, in regards to that, are there any statistics regarding the pandemic that you find valuable for our audience today regarding the response in Nigeria versus the US?
In all honesty, that is such a dynamic area, every day. So, and then the numbers don't mean as much, I think, as quality of life. So I kind of commented generically or holistically on some of the major issues, in regards to when they got the vaccine, the who that was affected, pretty much looks like the same picture. And their definition of comorbid diseases are things that, pretty much are more in the light with the respiratory disorders kind of thing
Mhm.
that would compound the complications associated with COVID. But I would probably not do justice in putting the right percentages and statistics on things compared to here. And then even the definition of minority over there to here
It's
is a
different.
little different. So I just would say that the pandemic is a global issue, and the same factors that are affecting us just have a different impact. So it's like a cut to us is really almost like an amputation to them in some cases because of the economic depravity and the state of affairs. They just literally had a recession in 2016.
Mhm.
So this pandemic, really is enough to push them over the
The edge.
ledge. So they're dealing with multiple issues in addition to a pandemic that's killing people.
Yes, it's unfortunate. Um, just going backwards a little bit, there is one question from an audience member. There are some people in the US who have concerns about the J&J vaccine due to religious reasons. Is Nigeria also experiencing this? Do you know?
So there's not been much conversation where I've been directly involved in regards to the religion aspect. So I honestly can't speak to that being a major factor in terms of treatment and or no. But I do know that there literally was a celebration in regards to the availability of the J&J vaccine, much different than what we did here. I mean, there was literally like this planned, almost cutting of the ribbon kind of ceremony
Wow.
about being able to get the vaccine. A lot of press conference, coverage just like we do, but it was just definitely like, oh my gosh, this is wonderful that we'll be able to treat, our citizens. And so I thought that was very impressive and heartfelt.
Yeah,
And even though, we started really ramping up, January, and to think that they're just getting the vaccine and
right.
how much we've been able to do, since January because of the availability of the vaccine, and they're just getting started. It just speaks to one, the impact of it and what the challenges that we have in terms of health disparities and access to care and things of that nature.
Yeah, for sure. That just made me a little sad. It made
Mhm.
me really happy, but at the same time to see that disparity between the two countries.
Mhm.
So we did touch a little bit about it, obviously, because you did mention in regards to some of the dean at some of the colleges or the universities in Lagos being present at the workshops or at the meetings. So do you see there is potential future involvement with the USF Taneja College of Pharmacy with the Pharmaceutical Society of Nigeria? And if so, how?
So it's interesting. I was just sharing with the dean that last week I was able to have a sidebar meeting with the current dean for the College of Pharmacy there. And I met also with what would be the equivalent of the chair of the practice department and a couple other professors and dignitaries from the Pharmaceutical Society of Nigeria. And as they have been explaining to me their educational process, one of the interesting things is that they're getting ready to convert that program to all PharmD.
Mm,
And so they have requested that we kind of coach them along and help them, kind of get everything lined up in terms of student training in the clinical environment. And certainly they don't, like the college is getting ready to go through an accreditation visit. Well,
right.
they don't have something similar
Oh,
where they go through accreditation per se. So I had inquired like about competencies that their students are expected to cover and to have, and they didn't have that. So we're going to be assisting with them. And they also have heard about the work that we've done with We Care. And so they have a very large interest area in terms of getting coached on community engagement
mm,
initiatives and all. And then we've also talked about either faculty exchanges or student exchanges years, down the line. But
yeah.
our other hope is that if we can just introduce the faculty between the two colleges, perhaps there'll be some opportunities for research collaboration. So that part I'm really excited, and that's the former chair and me,
No, for
just
sure.
thinking that there are so many ways that just the things that have gotten started could take on a whole different life. Because we hope that the vaccine will allow us an opportunity to definitely curve, the pandemic and its impact. Although this is here to stay, to some degree. And so
Right.
our messaging has been, in as much as we talk about the vaccines, we also need to emphasize the need to follow the CDC guidelines. And they have the equivalent of a Nigerian version of the CDC and all. So, those are things where the pharmacist can be positioned as a public health advocate, and certainly being a part of population health, kinds of initiatives. So yes, we definitely see a future, particularly with the Pharmaceutical Society of Nigeria, as well as the colleges. And I think on the side of the Pharmaceutical Society of Nigeria and Megamedics, which is the American-based component of the Pharmaceutical Society of Nigeria, I think there's opportunities at some point for our students to appreciate the level of involvement that their pharmacists have in the pharmaceutical industry, and that'll be a whole nother level. Although we have a very robust aspect of that, it's similar but different over there. So I think that may create some opportunities for new internships and other training experiences.
Yeah, that's great to hear. There's a lot of opportunities, and it's just us exploring and really bridging those experiences together.
Yes, yes.
We do have one question. Has traditional medicine been a hindrance in the vaccine distribution? And if so, how is it being addressed?
So they embrace, traditional medicine. Now, when you say traditional, is the question going down the line of alternative medicine, meaning herbal for us, but being traditional for them, or are they referring to what we call allopathic, meaning the traditional doctor prescribed medications?
I
So
think it might mean, well, I can't really assume, but based on the interpretation of the question, I think it might mean, like, for us, herbal medication, or in that sort or field.
So we have had some conversations about the use of elderberry and vitamin D and some of the things that we're doing over here.
Zinc.
Yes, zinc and things, the vitamin C and that kind of stuff. And I can honestly say that no, that does not seem to be an overarching preference necessarily. Or it does not come up because, again, they have a very robust community practice. Now the difference is that a lot of these countries, drugs that are prescription for us are over the counter for them in different forms or fashion. So no, that has not come up as a overarching concern that they're embracing that approach versus the vaccine. I think you still just in general have a lot of people that prefer that natural immunity approach versus vaccination, or their perception of what herd immunity really means, is based on misinformation and that kind of stuff. So it's either all or none. They either are going to get it or they're not going to get it because they've never gotten it. We're still fighting the battle, even here in the States, about the need for the flu vaccine. So, sometimes these less developed countries, experience that. Now, I also don't want to paint a picture that everything in Nigeria is low, of a lower value or socioeconomic or even educational basis compared to the United States, because it's not. Very intelligent people, very educated people, but you do have pockets, where it's not necessarily the same. Yes.
Yeah. And we have those pocket scenes here too, how people are resistant to evidence-based medicine or the research that's put out there. So it's definitely a global health issue. Sure. I did want to carve out a little bit of time to see if our audience have any more questions. I did have one question I was dying to ask, but I wanted to make sure we do give some time to our audience that is participating today. So there was a couple of questions and we've addressed them all. And thank you so much for all of your questions. It was great to hear, all of your perspective and your inquisitive mind. But one last question is, as you know, right now, USF is undergoing a strategic plan. Okay. So how do you see global health being tied in with USF and USF Health Strategic Plan right now?
Um, well, I think that one of the things the university recognizes is that we have an opportunity to draw international students. And in order for us to truly impact the community, we have to think beyond just our backyard. And I think that initiatives like working with countries like Panama and Nigeria, one, make us attractable for their citizens to consider us for an educational experience, but it also allows us opportunities to impact, again, a broader community by introducing what might appear to be more advanced, particularly medical practices, in areas that would normally have access to that care because of either limitations or differences in the educational process. So I do think that initiatives like these are very valuable and needed. Not only is it us always giving to them, them giving to us, but our students also can go and make a difference in communities like that as well. And I do think as a health professional, that experiences like mission trips also put our students in a mindset of understanding that the real purpose behind us being health professionals from the start is to help others and to give of our talents and experiences for the greater good, and to make a broader difference on something that's much more important than us and has nothing to do with us as individuals. And so I highly believe that these are necessary activities, which is why when opportunity has presented itself, I've tried to do my best to make sure not just me, but the college, the university at large, is present in giving us, visibility in areas where others wouldn't even know we exist, because we do a lot of great things at USF, but it could be even greater when it's impacting people that it doesn't have to impact. So that's kind of my philosophy on that. I hope that answers your question.
No, it does. It does. And, after obviously our own conversation between me and you,
Mhm.
it definitely has motivated me because, last night, even for me, I was searching what other communities, within my own minority that I can be involved with. And, I could reach out to really make a difference or offer my little but still somewhat knowledgeable background on the healthcare field. So definitely have impacted on how I look at global health and the disparity that we do have, not within just the US, but within, the world. So thank you for that. So this is going to wrap up our little conversation here. We do have one more question. Do you know of any studies that have been done that address the news of multiple medication and side effects related to the vaccine being given to patients?
So there are studies that are emerging, kind of telling us what people are seeing. We Care is in the process of positioning itself to gather information about people who've been vaccinated, people who've had the infection, certainly those like our long haulers who've had long-term effects from the vaccine. I think it's probably a little early and not so early for us to appreciate all of the drug experiences out there, but there is data coming from other countries, particularly China, that's kind of sharing. We're learning from countries that are a little bit more advanced than we are in terms of vaccination, like Israel and other places, and learning from them. So in terms of when you say drugs used to treat COVID, it may be what's happening on the inpatient, side. And so we still, have a need to, one thing we know is that there's no cure, and that we know the virus is doing what viruses do, and that it's mutating and getting smarter and learning, how to navigate in the human body. And so I think that this is going to be something we're going to be learning about, much like HIV, for years. And the sequelae from that, there's a whole lot more to come. But there is emerging literature, that's telling us a lot about what works and doesn't work, and in who and not in who, and when to give and what not to give and where, and those kind of things. Yes.
Right. Right. The one thing that I will speak upon is, we do have the vaccine adverse event reporting system. So that's VAERS. And right now, if you did get the COVID vaccine and you are experiencing side effects, whatever it may be, a fever, muscle ache, anything, it's really important that we report those, because then we gather that information and have it provided to see what's the most common side effects of this vaccine that you'll be experiencing. Now, even if it's minor versus if it's major, it's really important to report so that we use that report to really be able to disseminate that information, when the CDC builds your pamphlet to let you know what are the potential side effects, anything like that. In regards to multiple medication after the COVID vaccine, I think it's still a little bit new at this time. We're still monitoring those patients at this time, and we really haven't really gathered much data in regards to drug interaction or anything like that. But yeah, great
And
question.
if I could add, also, not only do we have the VAERS program, but we have about 3 other federal agencies that have set up surveillance processes
Mhm,
that have been used anyway for other vaccination efforts,
mhm,
and they're following people who have participated in the trials. And, the dean always says, and the public just may not realize that the vaccine had been studied, for 10, 12 years prior. Back during Obama's administration, there were dollars put in place to study the messenger RNA technology. So it's not as new as we think. We just haven't had an opportunity to test it as much as we have with the pandemic, but it was studied in disorders like HIV and Zika and Ebola and other things of that nature. So that's one thing. But the other part of it, where I was going to go, is that when individuals are in these surveillance programs and they participated in these early trials, in the phase 3 trials, they're being studied for at least 2 years.
mhm,
So we're learning from those experiences. But what we definitely know is that when we think about elderberry and zinc and some of these non-traditional approaches, they are not preventative, they are not curative, but they do provide some support to the immune system. But it just depends on the individual's comorbidities, age, and all these other things. And so right now it is early and we are learning. And then we are appreciating that different ethnic groups also bring different challenges to the table in terms of drug metabolism and the nuances that pharmacists like you and I, pay a whole lot more attention to. So I do think that this is, just the start of probably another decade or so of us learning about, the nuances of the disease, much like we've done with HIV. Mhm.
well, perfect. So seeing no more questions, we'll wrap it up here. Thank you so much, Dr. Hill, for being with us here this morning, taking the time to really talk to us about your experiences here at the college and over in Panama, and your experience with the Pharmaceutical Society of Nigeria. We really appreciate all the audience participating this morning. Thank you for our Zoom team, Mr. Casanova, Ms. Ding, Kevin Kishpaw, and Jamie Smith for helping us set this up. We really appreciate it. And we hope that if you have any more questions, please feel free to reach out to either of us, most likely Dr. Hill, because she's the expert here. But I'm more than happy to support, but feel free to reach out to us. We are both located over at USF Taneja College of Pharmacy. We are happy to entertain any questions that you may have had. Okay. Thank you so much and have a good day, everybody.
And thank you for having me.